Thank you all for coming today to our ACA Champions of Change event. I'm Stephanie Jones, and I manage the Champions of Change program here. We're so grateful to have you all, and it's going to be a really fantastic program, and we have champions who have come from all across the country to be here today. So I'm going to kick it off to Bess Evans, who's our Associate Director of Public Engagement and works on all our healthcare outreach, to begin the program and to introduce our opening speaker to you.
Linda, the check's in the mail for that comment. Thank you so much. Hello, everyone, and welcome to the White House. Thank you all so much for coming from near and far on this incredible anniversary week. 20 million Americans have gained access to coverage because of the work of folks in this room. And so for this 6th anniversary week, we couldn't let the moment pass by without asking you to come through security and into this room that I know you all know very well for a celebration. And we are so honored to have our Chief of Staff here. Unfortunately, our Secretary Burwell was unable to make it today due to an unforeseen personal incident. And we are so thrilled that Dennis cleared his schedule to come and speak to all of you. And it's not just a testament to the incredible work that you all do, it's also a testament to the incredible passion that Dennis McDonough, our White House Chief of Staff, has for this issue. So much so that even as a loyal Minnesotan, he called our Healthy Community Challenge winner in Milwaukee to wish them congratulations. I think those words coming out probably tasted a little bit like vinegar, but he was happy to do it because he knows that the work of folks in Milwaukee and the works of folks all across the country that you all are doing is changing people's lives. And so I am absolutely honored to introduce Dennis McDonough, our White House Chief of Staff.
Well, good afternoon, everybody. Thanks so much. I know I'm a very lame stand-in for Sylvia, but I'm honored to be here with you all. I just want to say before I start my remarks, what a blessing it is to work with Bess Evans. Yeah, all right. I will tell you that, it's, as you all know, because you've been with us every step of the way, there's been some real high points. There's been some real low points. October 2013 was a pretty low point. I'll be very candid with you about that. I know you all felt the same way. But throughout everything here with Bess, she is the same unbelievably determined and optimistic and committed person that you guys get to see all the time, and that I get the great honor to work with. So it's not only an honor to stand in for Sylvia, but a great honor to follow Bess. Now, so I just point out that, or follow on her welcome to the White House to welcome you here. I can't think of a better way both to end the work week of this 6th anniversary and also, as I'll say in a minute, and as I just said out front, heading into Easter weekend, than to be thinking about all the great work that you all have done and to take a minute to think about it and to celebrate it. It's now 6 years ago that thanks to an awful lot of very brave members of Congress, and also thanks to President Obama, that we set on a path to change the face of healthcare in this country. The president knew, as we also know, that we wouldn't be able to make that real and lasting change without the community leaders who would actually implement that change, and that's why we knew that we needed all of you who are here with us today and have been here with us every step of the way since the start of the debate and then since the implementation of the act. So I just had a nice chance to meet with our champions out front to hear about some of their work, and I've been in touch with many of them or been in their cities or been on the phone with them. And what I see in them and what I see in each of you and what I've seen and heard on the phone talking to community leaders all over the country is a passion for improving the lives of our fellow Americans. The work of our champions today and the work of all the navigators, the assisters, the community health advocates across the country, the HHS team here and across the country, is about passion for service and creation of opportunity for our fellow Americans. It's about lifting up our neighbors and our communities. It can be unbelievably difficult, exceedingly frustrating, as we just talked about, late nights, early mornings, sleepless nights. But we knew, and you all know, that it's worth it, because at the end of the day, this mission is about getting people access to life-giving health care. And because of this work, because of this passion for service, we've made unbelievably important progress. Today, thanks to the Affordable Care Act and to each of you, 20 million people are covered who would not have been covered had the President not signed that act into law 6 years ago, and you had not done all that amazing work over the course of the last 6 years. They're covered because of people like Rudy, who developed engagement strategies, Latino engagement strategies, that are still being used statewide by the marketplace in Colorado. They're covered because people like Ana Maria Garza Cortez, a leader in enrolling uninsured San Antonians, using culturally and linguistically responsive education and materials. They're covered because of people like Andrea Irvin, whose student enrollment phone banks made sure Georgia's young adults and not so young adults got covered. Those 20 million people have health insurance today thanks to people like each and every one of you, and our uninsurance rate is at the lowest it's ever been. Importantly, that's not the only change we've made, or the only change you've made. We also now see year on year over the course of the last several years that since the law has been enacted, health care prices have been rising at the slowest rate since we started recording such data. That's over 50 years. And because of the ACA, insurance is now better, covering more benefits, no matter which state it's sold in or where it's purchased. Before the ACA, America's 13.7 million cancer survivors, as well as millions more living with chronic diseases, had to worry about being denied insurance because of a pre-existing condition, had to worry about hiding their true malady for fear that it would become a pre-existing condition. Now they get covered. Before the ACA, people skipped checkups because they couldn't afford the appointment. Now 137 million Americans with private insurance are guaranteed preventive care at no extra cost, which means more diabetes cases caught early, more tumors found in time, more peace of mind for parents who are worried about a kid with a fever, or more kids in school with a proper vaccination. Families who once worried that their insurance would stop paying claims when they needed it most, even if you never missed a premium payment, a major illness could mean bankruptcy. Now annual and lifetime caps are a thing of the past. They're gone. This progress has improved people's lives, their health, but it's important that the ACA has always been about more than health insurance. It's about a healthcare system that puts patients, the people you work with every day, puts people at the center of this healthcare system. We've taken a tremendous step to change that healthcare system, but we obviously have more hard work to do. By continuing to build on the historic progress we've made, we can make our system work better, providing the highest quality of care for all Americans. We can continue to address healthcare costs for families, and we can work to make sure that the millions of Americans who have gained coverage know how to use that coverage. Progress isn't easy, but we know that our efforts are more than worth it, because what we've accomplished, or what you've accomplished in 6 short years, is undeniable. Those 20 million people with a peace of mind, billions of dollars saved, changes that are making the system work better for everyone. This purpose, this service, this progress is what you've got, what you fought for, and that we're all so grateful for. So that's why you're so important. That's why we're so honored to be able to have you here today and to be able to say thank you. And that's why it's going to be so important that we continue this work together. So I thank you for all that you do and all that we will continue together. And I hope that each of you reflects this weekend or later next month if you're celebrating Passover, or whatever seasons you'll be celebrating this spring, I hope you reflect during this season of renewal, for me, Easter, of what an incredible gift you've given to 20 million people. 20 million independent gifts. It's a great honor to be a part of such a group. It's a great honor to have been able to see those 20 million gifts given. But that's the baseline now. We got to go get the rest of the just over 9% who don't have it. So God bless you. Thank you very much.
Thank you so much, Dennis. And thank you all again for being here today and for those 20 million gifts. We just couldn't be more thankful. And we are so excited today to have 10 absolutely incredible champions of change that we are honoring from communities across the country. A little bit about our program today. We're going to have 2 panel discussions, one with 5 champions, the other with 5 champions that are led by some of our incredible colleagues at HHS and CMS, who without them, we would not be able to do this work either. So I'd like to just do a quick round of applause for the folks at HHS and CMS. There are a lot of folks here in the audience, so if you work with HHS and CMS on a regular basis and only know them by an email, hopefully today you will know them by a face, and they are absolutely wonderful and are incredibly dedicated to this work. So I'm going to call up Angela Botticella to introduce our first panel and moderator, and I'll turn it over to her. And just a quick note about Angela. Angela has been working on the Affordable Care Act long before it was law. There are photos of Angela, I believe, outside of Congress and outside of the Supreme Court fighting for this law. And we are so honored to have her as part of the HHS team. She is an incredibly dedicated advocate, an incredibly dedicated public servant, and it's an absolute honor to work with you every day, Angela.
I do love what I do and have fun with it. And in tradition of having fun with what I do, I'm going to change things up a little bit. Don't worry, this has White House approval. I am not going to be moderating this panel. I'm actually going to turn it over to a great colleague and friend of mine whose last day it is at HHS, who has spent the last 3 years. Her name is Casey Wolf. She's walking down here slyly. Come on. Casey has been a part of the HHS family for the last 3 years at the Office of Health Reform. Her focus has been solely on the Affordable Care Act and open enrollment within. She has been our rock. She has helped us get coordinated. For those of you watching, for those of you in the room who have gotten materials on the ground out of HHS and CMS, there's a lot of hard work that goes into those. For those in my office, External Affairs, who are supposed to get those out to all of you, Casey made sure we did it. So with that, I'd like to bring Casey up, say thank you to you, say hi to her mom, who is hopefully watching. Casey's moving out to California onto bigger and better things, but I know that she's going to continue to do great things to impact the community, whatever community it's in, if it's not the whole of America, if it's not the town you end up living in, or the whole of the world. I can't wait to see what you do, and thank you for taking my place on this panel. So, Casey, if you want to sit in my chair.
Let me give you a hug first. Thank you. Thank you.
And we can all love on each other, but let's bring up the people who really do the work in the room. Those of you on the ground who are honored as champions today, just thank you for everything you do to inform us of how to be better at HHS on a daily basis, to get you the things and the tools that you need to really get the folks who need to be enrolled in healthcare or understand their healthcare to get you those tools to be successful. So with that, I'd like to invite up our first 5 panelists. Brian with Health HIV, come on up. Yeah. Olivia with Montana Primary Care Association. Akash with Be Jersey Strong. Anna Marie with Centro Med. And Judy Solomon with the Center on Budget and Policy Priorities. Thank you so much for all you do, and Casey will kick off introductions, and I'm going to take that nameplate out from in front of her because that's not her.
Thank you, Angela. I really appreciate it. It's really an honor to be here with all of you. I'm really inspired by your work, and thank you so much for being here today and all the work you've done, not only this last open enrollment, but over the past 6 years to really make the Affordable Care Act the reality it is today. I'd love to start off by asking you each to introduce yourself, say a minute about who you are, what you do, what this open enrollment has meant to you, and what the past 6 years have meant to you.
Oh, just that. I'm Olivia Ryuta. I'm the Outreach and Engagement Manager with the Montana Primary Care Association, and I live in lovely Missoula, Montana. At the Primary Care Association, I work with all of our 17 community health center members. I'm excited to have a health center family member up here with me today, and have worked on outreach and enrollment since the first day of the first open enrollment period. Was my first day. It was an exciting one, and in addition to that, I work with all of the statewide outreach and enrollment stakeholders across Montana through a project called Cover Montana, and they are an incredible group of folks, and I wouldn't be here without all of their incredible, tireless work to enroll and reach their communities.
Good afternoon. My name is Ana Maria Garza Cortez. I serve as the Vice President of Marketing and Development for Centro Med, a federally qualified health center. I'm here representing our coalition, Enroll SA, Get Bear Covered. Of course, we've been enrolling families in the marketplace, but I've been participating in enrollment in Medicaid and CHIP for the last 15 years. So I'm really honored to be able to help families get the health care they need and providing the care and access to care through community health centers. Thank you.
Good morning, everyone, or good afternoon, I should say now. My name is Brian Huddage. I'm the Executive Director of Health HIV. We're based in Washington, D.C., and we also run 2 coalitions, Positively Healthy, which is for HIV-positive people and their allies, and the National Coalition for LGBT Health, which is comprised of LGBT providers, friendly providers, health centers, consumers, and others. And we've worked in a variety of enrollment efforts. In D.C., we were one of the assisters for that program, and Marissa Tonelli from our office led those efforts, so I want to recognize her for that. We also have created enrollment guides specific to HIV-positive individuals and to LGBT individuals called Get Enrolled, Get Empowered, Get Engaged, and conduct a variety of social media efforts ongoing to impact both of those audiences in particular. And so the impact that access to insurance has had in these 2 communities is extraordinary, and we're just so pleased to be a part of it.
Good afternoon. It's a pleasure to be in such great company. My name's Akash Shah. I'm a 4th-year medical student and the founder and executive director of Be Jersey Strong. We're a new nonprofit over in New Jersey, and we train and mobilize student community health workers to address health-related social needs and to promote a culture of health. And during this past open enrollment period, we recruited just over 500 students at 20 campuses throughout New Jersey to help their communities connect to coverage. And watching them in action was something, because one of the things you quickly realize is that students are incredibly well positioned to connect individuals to coverage. By virtue of being young invincibles themselves, they've got incredible sway over other young invincibles, and more often than not, they speak the language of individuals in need, both literally and figuratively. And when you place students in the communities they identify with, the connections they're able to forge are all the more powerful. And so, all, of course, a long way of saying, I couldn't be more excited about the role that student community health workers can be playing in promoting a culture of health.
Hi, I'm Judy Solomon. I'm a Vice President for Health Policy at the Center on Budget and Policy Priorities, a long name of an organization that does a lot of policy work. And we worked very intensively on getting the health law enacted, and then since then on sort of understanding kind of how are we going to implement this, and very quickly realized that we could be helpful in trying to explain it and provide support for the folks on this panel in the room, and really tried to do that, and had an amazing feedback on what we were doing, and trying to get people to really help understand the complexity and the barriers, and worked fairly closely from what we learned was going on the ground with our partners at HHS and CMS to sort of bring back some ideas for ways to make enrollment smoother. So I'm really thrilled to be here today.
Thank you, and thank you sincerely to all of you for being here today. I want to kick it off by asking you, Akash, to talk to, all of you have been working on innovative new ideas at the local, state, nationwide level. For you, what has the impact been of big thinking, trying new things? What has the impact been, and what have the challenges been?
Yeah, well, maybe it's because I ain't nothing but a dreamer, but I do think the importance of thinking big cannot be understated, particularly in our state. So over in New Jersey, we've got just over 500,000 folks who are eligible for Medicaid or the marketplace, but still without coverage. And in order to effectively connect them, the response has to be proportional, both in scale and scope. And so, 5, 10, 15 folks just won't cut it. I really do think that you need to think big, and what you need is 500 folks. What you need is 1,000 folks. What you need, to be perfectly honest, is 5,000 folks. And because I believe that when you get to that scale, you can reliably and responsibly respond to the invariably and incredibly local needs of communities. And, I'll give you a quick example of that. It was back in early January when the wonderful folks over at Region 2 of CMS, Jackie Cornell Bocelli, Thomas Bain, Frank Winters, Lakezia Carmichael, sent me an email and said, we have this amazing opportunity to connect with 5 major Hindu temples in New Jersey. We're talking literally reaching over 10,000 people in a single afternoon. But in order to do so effectively, we're going to need about 45 folks who are fluent in Gujarati. And, I can't see any other way to be able to produce 45 folks who speak Gujarati at the drop of a hat, unless you're working with folks who are 500, 1,000, 5,000 strong. And so I do believe that responding with big thinking is absolutely critical. The other thing I'll mention, though, is one of the challenges that comes with thinking big is, especially, and this may be unique to an organization like ours, which is quite new, it's absolutely critical to get governance right. Because I think when you're thinking on that scale, pitfalls abound, and having folks who are far wiser than you, far more experienced than you, and can help guide you through challenging waters is all the more important. It's one of the reasons why I'm grateful that our board chair, Dr. William Owen, is in the audience today, and we've got several other members on our board who have helped us do exactly that. So I think that's key for new organizations that are thinking big.
Thank you. So I saw some vigorous head nods during your answer, and so I actually want to open the same question up to the panel if anyone else wants to jump in on what the impact has been of thinking big.
So I think thinking big for us was really the thought that we could reach out and reach a lot of the assisters, navigators, and others in the community and establish a feedback loop with them to be able to maybe help them have their voices heard as they encountered barriers, as they had questions. And, I think one of the best things has been, finding some of the really complicated questions that nobody envisioned when the law was written, when I read it for the first time, and being able to bring those back and get some policy out and get those answers. And, I think having the opportunity to provide support to this amazing network of people who have worked so hard to get 20 million enrolled has been amazing for us as a national policy organization, and I have some of my folks in the audience as well.
Thank you. Yes, please.
I would just add to it, one of the things that we have said from the beginning was keep patient protection in the Affordable Care Act, and that to us as a nonprofit, it's about patient protection and the means to that through affordable care, but that we try not to say the three initials attached with the act, but rather talk patient protection. And patient protection includes people being able to live healthy, balanced, well lives. And that when we talk about the opportunity to protect patients and consumers by being healthy in every regard, it's a much better way of thinking big picture about how to get the attention of people and to relate that benefit to more than just the ability to get a test covered or an exam, but what their overall health and well-being will be like.
Thank you. So 20 million is an amazing, staggering accomplishment, but as we move forward, we want to be learning every lesson we can. So I'd actually love to talk about some of the challenges you guys have experienced. Anna Maria, will you talk about some of the challenges you've experienced?
Absolutely. You know, being part of this coalition and helping people find insurance has been a blessing. Many, obviously 20 million people have insurance, but there's still many states that do not have expanded Medicaid. So unfortunately, the poorest of the poor remain uninsured. And that's very hard for me to even say out loud and talk to families. The poorest of the poor remain uninsured. They may have access to care because of community health centers, so they're obviously being seen, but they're not able to receive the specialty care that they need. They don't get to go to the hospitals, or if they do go, they don't know how they're going to pay for it. They're not getting the medications that they may need. It's very challenging for low-income families, and these are working families who need health coverage but don't have it because we don't have expanded Medicaid in all states. And that's one of the challenges I think we see every day, in particular in our state. As we're helping families, we're unfortunately weeding them out to determine which families will actually be eligible and which will not. So to us, expanded Medicaid is a big barrier.
Thank you. Olivia, do you want to talk about what the experience has been like of expanding Medicaid in Montana?
Absolutely. And it's actually kind of surreal thinking, you know, a year ago, the legislation passed in our state legislature to begin for our Department of Public Health and Human Services to write the waiver, and coverage began on January 1st and enrollment began on November 2nd. And I feel I feel this challenge. So in my work, I'm a certified application counselor because I think it's important for me to do enrollment assistance as well. I do similar work to Judy on a statewide level. You know, I get those challenging questions and try to create a feedback loop, both to the folks on the national level, and we appreciate when we can send those emails and say, help. But now as we are implementing Medicaid expansion, all of the challenges that we need to work through on the statewide level. But so Montana is the newest Medicaid expansion state. It was a challenge, to say the least, to get it through, and we spent a lot of time telling personal stories and asking folks who had for so long not had access to care and had fallen in the coverage gap to stand up in front of lawmakers, in front of the media, and tell their story and talk about what it's like to live without coverage. We talked a lot about shared values and the kind of communities we want to see in our state going forward, and so thankful we were able to get the legislation passed. The waiver was written, it was approved, and it has been a very busy 6 months. You know, it has been a very busy 6 months, really exciting though, and we have, there's about 70,000 Montanans who are, we expect to be eligible to enroll, which doesn't sound like a lot, but there's only 1 million people in the state of Montana, so put it into context. And we've already, more than half of those folks have already enrolled. And we are hearing the feedback of the folks who've been able to get coverage for the first time, the folks who, you know, need everything from just access to a doctor when they have a cold or are sick, to the folks who've been putting off serious chronic illnesses for years and years. And so it's been an incredible process. we had the opportunity to work with a great policy and advocacy coalition to get the legislation through, and then working through Cover Montana and all of our partners implementing this. Enrollment assisters were really tired of telling folks that they didn't have any options. And so once we were able to start enrolling, it was, we went as fast and as hard as we could. And it's still going on. I think that's the exciting part. I talk to enrollment assisters all the time, and they are still busy and booked up, and there's a real need, and people are just thrilled to be able to finally get access to the care they need. And so I'm so proud of the work that I have been able to do in coalition with all these other great folks, and just proud of what Montana has been able to do coming together. And I'm really, I think now being a Medicaid expansion state, thinking about how we can be supportive to all those states who still have that fight ahead, because it is a complete game changer in terms of our work and the health and wellness of communities.
Thank you. So as we celebrate the ACA's 6th birthday, Judy, I'd love to ask you to talk a little bit about looking back. What have the greatest accomplishments been? And looking forward, what should we be focused on for the next 6 years?
So I think the accomplishment is 20 million, right? I mean, and it's standing the law up and getting technology, very complicated technology, to work to do a lot of improvements in eligibility and enrollment systems and make those connections. But I think as we look forward, it's important to think about the number 20 million as really understanding that that's there's 20 million today. We can count them. But, tomorrow, maybe one of those is going to fall off of coverage, or, how do we keep them enrolled? How do we get people through transitions? I think that's one of the most challenging things, because people don't stay in the same place. And I think we've all learned that. And if we're going to make progress, we have to hold on to the people we have. So we have to, retain them. In our enrollment work, we call about retention. But we also have to make sure that if their income goes up, they can make that transition from Medicaid to the marketplace. We certainly have to expand Medicaid in Texas and Florida and all those other states that haven't, so that everybody can have the pathway that was envisioned in the Act. But I think we have to really see that this job is never going to be done, so that even if we get the 9 more, we're constantly going to be having to help them make the transitions. People's lives change. That's what we've really found so much, is these, we're not talking about people with stagnant lives. Nobody's lives are stagnant. But I think the people who have benefited from the Affordable Care Act tend to have, lower incomes, and tend to have, people that are coming in and out of families, and getting all of that in place has been really challenging. And I think we have to keep that going as we find the more and hold on to what we have. I think and the job isn't going to be done. We have to obviously improve the technology, make it easier, do as much as we can automated. But I don't think we should ever feel that we will be done with this job.
Thank you. I want to open up the same question to the rest of the panel. Looking back and looking forward, what are the greatest accomplishments and the next things we should be focused on?
I think one of the greatest accomplishments of the Affordable Care Act is obviously the fact that families with pre-existing conditions are not denied access to care. That was one of the biggest issues we have seen in our community as well. So it's really nice to see that people with pre-existing conditions can get the health care they need and can still get the medications that they need, and the systems that are there in place for them. That's a big positive, I think, for the Affordable Care Act.
Thank you.
I think I couldn't agree more that the biggest accomplishment of the past 6 years are the 20 million who were brought on. I think one of the important things to keep in mind is, of course, that obtaining coverage is really just the first step on the way to obtaining care. And, I think coverage is incredibly important. As someone who will soon be an emergency room physician, through my training, I've come across story after story after story of someone who's benefited from coverage. But the number of health-related social needs, the number of other programs, and the number of other care-related interventions that these individuals can benefit from now that they have coverage is absolutely critical. And I know that we've got some folks who have done phenomenal work around this. So,
Well, that's actually a perfect segue. I think for the remainder of our conversation, I really want to talk about that piece. How do we go from coverage to care? How are we engaging and empowering consumers to be at the center of their care? As you guys walked in, you saw a handout by one of my fabulous colleagues that talks a little bit about some of our ideas. We really want to hear yours. And Brian, I'd like to ask you to kick off a conversation about what does coverage to care mean to you and the people you serve.
Great. And I agree, it's only the first step. We're so focused on getting people enrolled, and it really is only the beginning of our work. And while it's, it said build it and they will come, and that's certainly been the case with 20 million people, and there's certainly a lot more that we need to do. But once people are there, we also have to build it so that they stay. And so by that, it's looking at course corrections, culturally competent approaches, and health literacy efforts that really get to people, to speak to people where they are. And so it's just like where it's an opportunity to enroll someone when they're in the emergency department or at a health center, and not at a street fair or somewhere where they're not thinking about their health or they're not presented with a health issue that they need to address immediately. It's the same thing about saying, now that I have insurance, now what? So one of the things that we did in our materials, both online and print, was to just explain, how do you use your insurance card? What is this card? What do I do with it? What does it mean? Another thing that we looked at was, how do you find an LGBT-friendly provider? If you're in the transgender community and you have had a bad experience with a provider, you're hesitant to go back into care. Likewise, for HIV-positive individuals, how do you find a primary care provider who has expertise in HIV care? And then, how do you not just identify who they are, but how they function? So what's cultural competency mean? What does health literacy mean in explaining your benefits, giving access to preventative screening guidelines? And what can you can go in empowered to say, well, my understanding is that this would be covered, and that you take that ownership and that empowerment as far as possible. And then continuing that pressure, if you will, through social media, always reminding people. And I want to say, I think HHS, the White House, CMS have done a great job in social media, in putting up infographics and putting out information that keeps people connected and gives us material that we can repost and share. And then I think community groups need to take that and add to it and focus it on the populations they're reaching, and be very practical, that we shouldn't be embarrassed about asking anything about our health plan. The one thing that I think, and the last point on this, one thing that's always been somewhat surprising is the extent of the act was such that hundreds of people wrote components of it. So I don't think there's anybody anywhere who could tell you everything that's in the act. And then, of course, as with anything else that's progressive, you need to continue to modify and address things as you move along. And so none of us should be embarrassed to ask if something is in the Patient Protection and Affordable Care Act or not, and that we put things in terms that people can engage in it in an optimistic way, which is what I meant about the wellness. So I think all of those things are very much what's going to keep people connected.
Thank you. So I want to ask each of you to weigh in on this question. When you think about your community, what are the issues that people are facing to connect to their care? What are some examples from your community, and what are some great practices from your community? Olivia, we'll start with you.
Sure. So I think that we have done incredible work, and I think it's really exciting and important to stop and celebrate. I feel like we're probably all people who are like, okay, check, put your head down, and like there's more work to be done. So this is good for us. But I think it's really fine-tuning it, right? I think how do we we have been so busy enrolling folks, learning how to do enrollment, kind of learning this whole new system. I think we're now having a little bit more space to fine tune that work. And so what are the really hard to reach communities who have nuanced needs? In the state of Montana, we have a large American Indian population. And if an individual is eligible for Indian Health Service, a tribal health services, or an urban Indian health center, they have specific coverage to care, like their health insurance literacy looks really different. And so it's really thinking about how do we take all of this great work that has been done, continue to fine tune it, and just recognize that the work, the work never stops. We have to maintain all of these people and keep moving forward. But I think this space is super important. After 6 years, I feel like there's a little bit more breathing room where we can really kind of relook at the communities that we are serving and think about prioritizing and digging deep into the stuff that we haven't had the chance to really dig into yet. And so I'm looking forward to that when I head home.
Thank you. Anna Maria?
Yes, one of the areas that we always see is enrollment goes hand in hand with education. We need to teach our families, once you're applying for this health insurance, we want to make sure that you understand how to use it. We have a health literacy collaboration that we can educate our communities. When they come in, we do sessions on just the glossary of terms so that they understand what is a premium, what is a copay, when should I go to the doctor, the importance of not overutilizing the emergency room, but actually developing a plan to choose a PCP, establish a medical home so that somebody knows you and understands what are your health care needs, making sure that these individuals understand how to access care. We know of a story where one of our clients called us as soon as we helped them get insurance. They're like, as soon as I received my card in the mail, I went right back inside the house and made an appointment with my doctor because she hadn't had an appointment in a long time. So these are some of the areas that we're really focusing on, but we still have the issue where there's a lot of misunderstanding about who's eligible and who's not. Clearly, because we don't have expanded Medicaid, so it's still challenging to get that word out. We're still going to keep reaching out, and we do this year-round. We don't wait till just enrollment period. We do this year-round to educate the community about how important it is to access care.
Thank you. Akash?
Well, I think one, you'll have to forgive me in advance. You asked for a story, and I'm a storyteller at heart. So, one of the stories that's coming to mind from some of our work in Jersey and prior is that of an incredibly engaging woman by the name of Miss Jones. Miss Jones was a 48-year-old woman with no insurance and a strong family history of breast cancer. And when I say strong family history of breast cancer, I mean her grandmother had died of breast cancer in her early 50s. Her mother had died of breast cancer in her early 50s. And her sister, I believe just 2 years prior, had also died of breast cancer in her late 40s. And so, Miss Jones, she can tell you all the fancy stuff they teach us in medical school. She can tell you about BRCA1 and BRCA2 mutations that render a defect in DNA repair that predispose you to developing breast cancer. But she could tell you the bottom line real well. And she told it to one of our volunteers the first day she met him. She said, look, it is a virtual certainty that I'm going to develop breast cancer. She's absolutely right. And she said, because of the loved ones I've lost to this disease, I also know that if I don't get the surgery and the chemo radiation when I do, I too am going to die of the disease. And again, she's absolutely right. And then she confessed, she said, and that's care I can't get because I'm uninsured. And then she confessed to our volunteer that just a week prior, she had done what so many of our most vulnerable patients end up having to do. She had said a prayer, jumped on a local bus, and headed across town to the emergency room, thinking that there must be someone there who could help connect her to the care she needed and deserved. And I say this from a place of love, as someone going into emergency medicine, but in an emergency room designed to treat heart attacks and strokes and injuries from car accidents, but not lack of insurance, all she got was a brochure to enrollment. And little did her providers know that she had actually been on the website twice, but had been unable to enroll because the process was just a little too complex, a little too overwhelming. And so she left that day no better off. And I'd say worse off, because one, she'd have a bill coming her way in the mail. And more importantly, I think her faith in the system, or her faith in us, had been shaken. But she did that Sunday what she always does. She went to church. And it's there that she connected with one of our volunteers. And so she told him her story. He listened, was moved by it, as I think anyone would be, and then said, all right, well, tell you what, let's keep this conversation going. I'll be here, same time, same place. Come with your questions. And so he came back that next Sunday. And then he came back that third Sunday. And by that point, she was ready to enroll. He was ready to help her. They opened up his laptop and got her connected to the care she deserved. And he saved her life that day. And I don't think that's an understatement. I think he absolutely did. But in addition to illustrating some of the barriers that we see in our local communities, it also reminds me of why I'm so excited about the work we do in engaging students around this, because that particular volunteer, he realized that he saved her life that day. Unsurprisingly, he realized that he loved that feeling. And so shortly thereafter, he decided he was going to go to medical school because he loved saving lives, and that's what he wanted to keep doing. And I'm happy to report that as of a couple months ago, he just matriculated to the University of Alabama Birmingham Medical School. And I think that's part and parcel of why we do this work, because I really do think that when you bring student community health workers in the service of our patients and those in need, it really is a win-win.
Thank you very much. Thank you for sharing that. That's very moving. Judy?
Yeah, so we're a policy organization. We don't work really in the field, but I think we did what Olivia mentioned. We've took a breath recently, and we thought about this issue of, what could we bring to the next step in terms of connecting people, and we realized that because we work across multiple issues, we have very strong national policy experts on housing, on food assistance, on income security, that we could begin to think about this issue of how do we connect our work. And we all come to the center and we work in our little areas. We have a health team hall, and we realize that we need to reach across to our housing team and start thinking about how can we integrate the work that we do. Because I think, Akash, you said it early on, the culture of health, the social determinants of health, knowing that it isn't just healthcare and it is getting people into safe housing and getting them the right nutrition. So I think after we've taken that breath, that's our sort of next, in addition to keeping the other work going, I think that really is the step that we all can really take to, we got the healthcare, now we need to connect it to the other places.
Thank you. So in our last remaining few minutes, I'd like to start with you, Judy, and go down the line and ask you all, what do we need to be doing right now, this summer, this spring, to not just be ready for open enrollment next year, but be ready for all these other things you're talking about, engaging and empowering consumers, promoting coverage to care, and really looking forward to the next 6 years?
So one thing that I'll mention here, because I wanted to mention, I don't know if it exactly fits, is that I think, the work that we've done in the education and training of assisters around the country, as well as now beginning to think about connecting people to care, I think one of the things that we really need to think about is how do we create this as sort of a professional pathway, to make this a workforce that supports people across getting covered, getting care, and is a career pathway for them. And I think that's something that we all can sort of start thinking about right away, get ready for the next open enrollment, get the training done. But I don't think, as I said, I don't think this ends. So if we are going to keep doing this work, if we are always going to have new people who need to get enrolled, we have to think about how we support the people, many of whom are in this room, who are doing that and those to come.
Thank you. Akash?
Yep. So I think actually reaching back to one of the things you mentioned about creating a culture of health and addressing some of the social determinants, I think one of the things that we're really looking forward to, and I think we absolutely need to do, is forge really strong connections with other programs in the community that address food security, housing and heating assistance, educational and employment opportunities, because I can tell you as someone who has spent a good deal of time seeing patients within the emergency room, that much of what brings them there, especially those who are most in need, happens outside of the four walls of the hospital and is going to be influenced by the things going on outside of the four walls of the hospital far more than anything I or one of my colleagues can do within the four walls of the hospital. And so finding ways to make sure that we're working together outside is going to be critical, because I'm absolutely convinced that our healthcare systems can prescribe and address some of these health-related social needs, and I'm willing to bet it's either dollars to donuts or donuts to dollars, that if we were to do exactly that, we would go a long way in creating much, much healthier communities.
I would just add that that we look at getting the patient experience as much as possible and the consumer experience from what people have gone through, and kind of look at where we're at without making assumptions about what people have experienced, so that we can be developing the processes, the materials, and so forth now, so that during enrollment period we're not as crazed. So taking that breath now to be able to also look at what are we missing, what are people experiencing, and at the same time, by talking to people about what they've experienced, is to share those stories and what access to healthcare has meant to people. I'm worried that we don't have enough champions that talk about what health insurance has done for people, and that we have to continue to promote it more, and unabashedly and unapologetically we have to look at it that way, because there are forces that, for whatever reason, don't place a value on health that they should. And so I think we're obligated as nonprofit community groups to continue to show those successes, and so that there's no question about the necessity of the act.
Thank you. Ana Maria?
Yes, right now we actually are continuing to promote the awareness of the Affordable Care Act, and although open enrollment is closed, we're actually just having educational sessions, inviting people to learn more about it, also to learn about Medicaid and CHIP, which is available to the children and women who are expecting a baby. Well, we're fortunate to work with a coalition of over 100 partnering agencies that are getting the word out, and we're inviting more agencies to join our coalition. We meet regularly, so we're inviting more universities to be part of our coalition. We're fortunate to have Enroll America, Cristo Santa Rosa, a lot of the hospitals, Methodist Healthcare Ministries, and a lot of faith-based agencies that are part of our coalition in reaching out to more, and also the business community, because they may not be offering insurance and their employers need to know. So it's constantly working with the coalitions and the different agencies that are available, all of the nonprofits in San Antonio, and obviously we recommend this for everyone to do. But if you invite more people to be part of your coalition so that they can get the word out, we can distribute the information to everybody and get more people signed on.
Thank you. Olivia?
Well, you all said really smart things, so I'll repeat a few of them. I think it's really about looking at health equity and looking at the social determinants, and how do we get out of our silos and think cross-issue. People don't live their lives in silos. If they need food, if they need housing, if they need access to care, it's all that same person. And so how do we change the work to better address people's needs? We're really thinking about working more with folks who are involved in the criminal justice system, thinking about how do we create safe, accessible, and healthy built communities? What role does that play in the social determinants of health, and actually allowing people to improve their health outcomes, improve their quality of life, which is ideally that's the goal at the end of the day, right? The goal isn't just to see the doctor. The goal is that that person gets to go home and is able to work and support their family, is able to have access to safe and affordable housing is able to thrive. And so I think keeping that big picture in mind, and I think telling the stories, I think we need to celebrate the experiences and what has really happened. And I think stories are super powerful, and people are really excited to tell their stories. And so I think it's hard work, and that's what we are thinking about as we move forward to continue to do that.
Thank you. To everyone here in the room and to everyone online, thank you sincerely for all the work that you've done, and thank you so much for joining us here today. Please join me in thanking our guests. Thank you very much.